Welcome back. Health experts are sounding the alarm about a disease with similar symptoms to COVID-19. We're talking about Lyme disease, a ticking time bomb that poses a serious threat to families here and nationwide. Health reporter Haley Hernandez has details on how to spot the difference between the two.
Right now, headaches, feeling stiff, dizzy, and being in pain would probably sound alarms of a viral infection. But according to the CDC, those are all symptoms of Lyme disease, too. So here are the differences to keep in mind as you head outside. A lot of people are eager to find outdoor activities and take a break from cabin fever. But these great outdoors can increase your chances of Lyme disease, a tick-borne illness. It's treatable the earlier it's diagnosed, but during COVID, that might not be so simple. Lyme disease typically peaks this time of year, July, August, and can cause a fever, body aches, fatigue. Sound familiar? But there are some differences between Lyme and COVID that you should cling to if you suspect you have one.
COVID patients will see they may lose their sense of taste, their sense of smell, and they'll also experience shortness of breath and breathing problems, those sorts of things you don't see with Lyme disease. Now, the main thing you see with Lyme disease that you don't see with COVID is a bullseye type rash at the site of the tick bite. Now, that's not always the case, but the majority of the cases will have a rash of that type.
Any lab tests now test blood samples for the bacteria that causes Lyme. They do not test for COVID, but do have antibody tests. Lowry says a lot of patients come in here after a misdiagnosis looking for answers.
They tend to always have a problem and they're trying to figure out what's going on. And Lyme disease is not always the case, but it's something that is not frequently tested for.
If you suspect you have Lyme disease, the lab says test results for that can come in a lot quicker than a lot of COVID tests. They're usually available in about 24 to 48 hours. Of course, if you have the tick that bit you when you got symptoms, you can place that in a plastic bag and take it to get tested too. I'm health reporter Haley Hernandez, KPRC Channel 2 News.